Hi, everyone. I'm Laura Siminoff. I'm the Dean of the Temple University College of Public Health. And today, our faculty experts with us are Graciela, Jaschek, Sarah Bass, and Heather Murphy. And last video, we talked about how the guidelines and everything changed so rapidly. And so today, we're going to talk about something that I think has caught everybody a little off guard, which is the new CDC guidelines. So we'll talk about those and what some of us have thought about those guidelines and what we think people should be doing, or at least what we're planning on doing ourselves. So maybe, Graciela, do you want to just talk about what those, in a nutshell, what those guidelines said?
Okay, so the guidelines essentially, the CDC came out with guidelines at the beginning of last week, and then they were slightly revised at the end of the week. But essentially, what it said is vaccinated people no longer need masks or social distancing, both outdoors and indoors, which is stunning. It's too early. I think that there are still many questions about where the variants are taking us. There are questions about people who are immunocompromised, people who have children who cannot get vaccinated, even though the Pfizer vaccine was approved for children 12 to 15. Those who are younger than 15 are not going, we don't expect that they will get vaccinated, or Pfizer will have a vaccine until September. And we really don't know, essentially, what's going to happen.
Right.
And it's a problem.
So, yeah, absolutely. I mean, 37% of the country is fully vaccinated. That's the whole country. And 47% are partially vaccinated. And we should be clear that partially vaccinated does not mean you're vaccinated. You still need, for the most part, if you're taking Pfizer or Moderna, a second shot, and that's 3 to 4 weeks later. And then 2 weeks after that, you consider yourself fully vaccinated. So, like Heather, I know you're in Canada right now. What do Canadians think about these guidelines?
Everyone was completely shocked. And the Public Health Agency of Canada came out with a statement saying we're going to take a more cautious approach than in the United States, and we're nowhere near the full vaccination that you guys are. But I think we're at 40 to 45% of the population has had one vaccine, and then only maybe 3% has had the two, but they're aiming for 75% to have one vaccine by July 1st. And then the second will roll out, but they haven't talked about any unmasking for a long time. And the Canadian public's been trying to get answers from the government as to what will the plan look like as the vaccine uptake increases. But we're still in lockdowns, and we're in a pretty scary third wave. So I don't think our situation is going to change anytime soon.
Yeah. My concern is that, yes, we have falling numbers of cases, but if you look, like we're in Philadelphia, you look at the ICU bed usage, there is one hospital that's over 100%, several others that are in the 70 to 80% ranges. So the ICUs are pretty full with people. It's not just COVID, but other things happen to people that cause them to get very sick and die. And yeah, the numbers of cases are down, and yeah, the test positivity rates are down, but I don't think they're where they need to be. And
well, I think part of the issue, they kind of had a public relations issue, right? Which is that, from a messaging standpoint, it was, we want everybody to get vaccinated, but you still have to wear a mask. And so it was like I talked about the last video, where this kind of carrot versus stick approach. This is the carrot approach, right? So it's that, well, if you get vaccinated, you don't have to wear a mask anymore, and you don't have to worry about these things. And unfortunately, the gray areas are not taken and counted for with this kind of announcement. And I think that it, as the messaging for COVID has really been really poor the entire time. I think it is here too, in that, you know, it kind of took everyone up by surprise. And all of the states kind of scrambling, all of the companies scrambling, trying to figure out what this means.
There is a lot of confusion, but I want to add something to what Laura was saying, that is that the new, Indian variant, the B1617, is spreading in Europe. In fact, it's becoming the most common in the UK, but here in this country, now 10% of cases in New York are due to this Indian variant. And in Western states, such as Utah, Colorado, it's up to like 20%. And this variant is more transmissible, but also it evades the immune system. The vaccines are, initial studies show that the vaccines are still effective against that variant, but not as effective, which means you still, even though you're vaccinated, you still have the chance to get infected. Now, when you have the vaccine, if you get infected, then you avoid hospitalizations and deaths, which is really good. But you are transmitting it still, not as effectively, but there is a certain possibility of transmission. So you have to realize.
Graciela, do you know like how much less effective the vaccine is against the Indian variant?
I'm not 100% sure, but it was in the order of 60 to 70%. So that means that 40% you are still going to get infected.
Right. And even if you don't get really sick or need hospitalization, you could still have some of those very long-term effects that people are reporting. So it doesn't mean you're just going to have like a little cold and then you're done with it. So that's the case as well.
Yeah, and then I think we forget about that. We forget that although younger people don't get as infected as or severely have severe outcomes as the older people, they still get hospitalized. They still get this long COVID. And children, in fact, have this misseeded multi-system inflammatory syndrome. And that's really serious. And some children have died and some young people have died. So we still have to be aware that wearing a mask and social distancing is important, particularly when you are indoors. Outdoors, you can relax a little bit, but indoors, that's not a good idea not to wear a mask.
And I guess the CDC wanted to kind of give this carrot, I suppose, and try and incentivize vaccination, but without any accountability and people get checking whether or not you've been vaccinated, it doesn't put any pressure on people to get vaccinated. It kind of does the opposite.
I think it creates a whole system of free riders. I was in a little rural hardware store recently, like yesterday. Nobody was wearing a mask. Now, you cannot tell me all those people were vaccinated. They were not. Everybody, I think, just says, okay, no mask. Who knows? I mean, who's to know that I am not personally vaccinated? So I'm not going to wear a mask and nobody's going to come up to me and say, where's your card, whatever. So I don't know, Sarah, what do you think? I mean, I agree we needed some carrots, but just thinking off the top of your head, what do you think might have been the better approach to the carrots?
I mean, I think it is very hard because I think people do see things, in such black and white ideas. And because we are, all of those kind of early adopters have gotten vaccinated, and now they're really trying to pull in, the harder group. And I think the reasoning behind this was, the only way we're going to entice some of these harder to reach folks to get actually vaccinated is to make it very clear for them what the positives of it are, and that this was one of those positives. I think it wreaks havoc with, as we talked about, just social responsibility and people not feeling, they can kind of be undercover, and as you call them, freeloaders, and that, they
Well, I said free riders. I didn't
free
call them
riders.
freeloaders.
I don't know, they're kind of freeloading too, right? On those of us who are vaccinated, because there is no accountability. We don't walk around with a big V on our foreheads. And because of that, it can be really difficult to ascertain what the real risk is. I was downtown on Saturday, and there's, we went from, I was probably downtown a week or so ago, where pretty much everyone had their mask on, to Saturday, no one had a mask on. So it was, the uptake of that, of not wearing a mask, was quite quick. And you do wonder, how many of those people actually were not vaccinated and kind of, under the radar.
So I have a question for you, Sarah. I was reading this morning an article about a study that they conducted in the UK, and essentially they found out that people are more likely, or there was a slight difference, people are more likely to sort of think about getting vaccinated if you focus on the individual benefits, such as being not getting hospitalized, not dying, versus talking about the good for the community, the herd immunity, and all that. What do you think about that?
I think that's actually correct. I think that us assuming that most people care about the whole community, unfortunately, is usually not right. And people see it very, personal to them. So, most of the messaging around it being important to you, and why it's important to you, I think is more persuasive for most people. I mean, some of the preliminary survey data that we've done in Philadelphia has seen the same thing. So we haven't seen that the idea that, this is for your community, you're trying to take care of your community. And honestly, a lot of the public messaging from public health departments has been that this, we're all in this together, we're doing this together kind of thing. And it's not really persuasive for most people.
Right. So what I'd like to do as we wrap up is maybe everybody just themselves say, what will you do? What would you recommend that people do as we move forward into the unknown before the next unfortunate surge occurs? Maybe we'll start with Graciela, then go to Heather, and then Sarah.
Wear a mask, social distance, particularly if you are indoors. And if you absolutely, if you are outdoors and then you are walking and there are not many people around, then it's okay not to wear a mask, but be a model to the community and wear that mask, and particularly when you are indoors.
Yeah, I have to agree with Graciela. I will not be taking my mask anytime soon. And I think for the long term, I will wear a mask to the grocery store and crowded places until we're pretty sure that this is calmed down. I guess I'm too scared of the virus and I don't want to transmit it to anyone in my family. So yeah, most definitely indoors. I think masks are still the right thing to do. Outdoors with family and friends at a distance. Yeah, maybe if everyone's vaccinated, take masks off and everyone's vaccinated, but in these indoor environments, you're not going to know who's vaccinated and who's not. So, and like we were talking about, we don't know if you could transmit it anyway if you are vaccinated. So I think the risk is still quite high until we know more.
Yeah, I mean, I would agree with those things. I think the only thing I would add is that, we as people who are vaccinated and people who are working in public health have to keep talking about the benefits of vaccination and why vaccination is so important, and maybe changing some of our messaging to not be around this idea of herd immunity and, you know, we're taking care of the vulnerable, but to really focus on these very specific personal reasons that are important for getting vaccinated.
Right. So I agree with all of you. I will be, even though I'm all fully vaccinated, I will continue wearing my mask and indoors and stores. If I'm in outdoors, really crowded area, I will wear my mask. I urge everybody to do so for their own benefit, let alone anyone else's, but for their own benefit, they should do so. Where I'm really unclear about the variants and how effective the vaccines are truly going to be with them. So thank you again for joining us. I hope you'll view some of our other videos, find links to reliable sources of information at our website, cph.temple.edu/coronavirus. So thanks for joining us.